name is Mercy Doris Fernandez and this is Snow Fernandez. Today I'm going to perform a PE on snow. So PE consists of two parts, distant examination and close examination. Distant examination is allowing the dog to move while observing mentation, posture, gait, behavior. So if let's say snow is having stiffness of movement, then I can suspect some polyarthritis going on, or if her back is arched, there can be some abdominal pain. And if she has a stiffening of movement of her neck, then there might be some hernia of the disc, herniation of the disc. So I can also observe her movement of a thoracic wall and rate. Proceeding, I can also observe movement of the thoracic wall to interpret her respiratory rate. Moving on to close examination. The first thing is head and neck. So in the head and neck, is there any symmetry of the skull? And everything looks fine with the skeletal system of the head. Proceed to the eyes, eyelids, third eyelids, conjunctiva, sclera looks clean, cornea is clean and glistening, pupillary reflex, okay, palpebral reflex, okay. Proceed with the ears. Is there any reddening? Are there any mites? Discharge. Proceed with the nose. Is there any nasal stenosis? Is there any discharge? Philtrum looks fine. Mouth. Open up the mouth. Mucus CRT less than 2 seconds, indicating very good perfusion. Pale pink mucous membrane. Open up the mouth. Shouldn't be able to see the tonsils unless there's some inflammation going on, and palpate from the larynx all the way to the trachea. If there's no coughing, there is no tracheitis or tracheal collapse. Moving on, the second is this integument. So with both my hands, I'm going to feel all over the body for mass. For any alopecia or for any erythema, everything looks fine. If I have a fleeted comb, I can use on her. And thirdly is the hind forelimbs. So any pain, any swelling of joint, knuckling, she's responding well to this knuckling for her prior perception. And fourthly, the thorax. Symmetry of the ribcage looks okay. Proceed with hearing the heart sound, heartbeat, and also pulse. So I'm gonna in-sync heartbeat and also pulse, femoral pulse. Okay, lung sounds. No any continuous lung sounds like wheezing, no crackles. Proceed to the abdomen. For abdomen, I'm going to palpate from cranial to caudal or dorsal to ventral. So in a dog, usually we can only palpate the caudal aspect of the left kidney, and also the bladder can only be palpable if it's full. Comes now. And intestines. Okay. Moving on to the hind limb, the same process as the forelimb. Knuckling. Okay. And moving on to the urogenital system. Come. Check the So there's no any external discharge, there's no reddening, her mucosa looks normal. And moving on to the rectum. So I can also now take a rectal temperature. Guru, I can pause on. this is me inserting the thermometer into the rectal and waiting for about 30 seconds to get the temperature. So in a dog, there are few common lymph nodes present, but there are only certain that can be palpable. The submandibular, the prescapula right in front of the scapula, and the popliteal. So the popliteal lymph nodes are directed behind the stifle joint, and so the popliteal is directed right behind the stifle joint, and there are two which cannot be palpated: the inguinal lymph nodes and also the axillary lymph nodes. So that's all from me and Snow. Thank you so much and have a good day.